Dear viewer, you've probably been told since childhood that cleanliness is next to godliness. That if you don't shower daily, you're somehow not presentable, not respectable. But then, we age. And with age, everything changes, our energy, our routines, and especially, our skin. I once knew an old man in our neighborhood, 78 years old, sharp, proud, and disciplined. Every morning, without fail, he would shower with hot water. He used to say, "A man must live clean, in thought, in food, in body." But one day, he didn't come out as usual. We found out later he had slipped in the bathroom. Just one fall, but it fractured his hip. From that day on, he needed a walking stick. It wasn't just physical pain, it was a turning point in his life. And it's not just about slipping. Have you noticed your skin becoming drier, itchier, or more sensitive as the years pass? Even if you don't use strong soap, just hot water alone can cause your skin to tighten, crack, or flake. Some people feel utterly exhausted after a bath. Dizzy. Cold. Drained. We've lived through so many seasons of life, witnessed our bodies' changes, and yet, some habits cling to us. Daily bathing is one of them. What used to be healthy at age May 30th no longer serve us at 70 or 80. Now, you might wonder, if I don't shower every day, will people think I'm dirty? Will they judge me? But my dear, aging is not the time to live for other people's opinions. This is the time to live wisely, for your safety, your comfort, and your peace of mind. In today's video, I invite you to look deeply, with compassion and curiosity, at one simple but powerful question: should seniors over 70 really bathe every day? The answer might surprise you. It might even shift a belief you've held your whole life. But I ask you to keep an open heart. Because this is not just about hygiene, it's about well-being. It's about preserving your energy, your independence, and your dignity. You don't need to change everything overnight. But if by the end of this video, you can begin to see things a little differently, if you can begin to care for your body more gently, then that alone is a quiet revolution. Let's continue. Let's get straight to the heart of the matter. Daily bathing is not necessary for seniors over 70, and in many cases, it may even do more harm than good. Truth number 1, your skin is more fragile than ever. As we age, the skin becomes thinner, more delicate, and loses its natural oils. The outer layer, once plump and protective, dries out. Hot water and soap strip away what little oil remains, leaving the skin brittle, tight, and prone to cracks. Even tiny cracks can allow bacteria in and become infected. Truth number 2, bathing too often increases your risk of skin infections. With a weaker immune system, seniors are more vulnerable to bacteria and fungal growth, especially in moist, folded areas like underarms, groin, and under the breasts. Overwashing breaks down the skin's barrier and may lead to rashes, inflammation, or chronic skin conditions. Truth number 3, daily showers mean daily risk of falling. Bathrooms are slippery. Wet floors, steam, and awkward movements are a dangerous mix. For elderly people, especially those with joint pain, dizziness, or low vision, stepping in and out of a tub can be treacherous. A single fall can result in a broken hip or head injury. For some, it can mean the end of independent living. Truth number 4, your body already knows how to stay clean. Your skin is home to trillions of beneficial bacteria, your skin microbiome. These microscopic allies break down sweat, control odor, and protect against harmful germs. But when you scrub too hard or too often, especially with antibacterial soaps, you disturb this balance, making your skin more vulnerable. Truth number 5, experts now recommend bathing just 1 to 2 times per week. Unless you sweat a lot or live in a very hot climate, most doctors and dermatologists agree that bathing every day is unnecessary, even harmful. Instead, they suggest sponge baths with warm water and washing only key areas, armpits, groin, hands, feet, between full showers. Truth number 6, showers can drain your energy. Many older adults report feeling tired or dizzy after a hot shower. That's because warm water dilates blood vessels, dropping blood pressure and straining the heart. For those with heart conditions or respiratory problems, showering can feel like climbing a mountain. Truth number 7, cleanliness is more than water and soap. It's about self-care. Fresh clothes. Washed hands. A combed head of hair. A spritz of gentle body mist. These small rituals maintain hygiene without the physical toll of bathing. For seniors, this shift is not just practical, it's empowering. In short, bathing less often doesn't mean neglecting hygiene. It means redefining it, in a smarter, kinder way. Dear friend, now that we've explored these truths together, I hope you can begin to see that sometimes, a small shift in thinking can open the door to better health, and deeper peace. Bathing every day is no longer the gold standard for those over 70. In fact, for many, it's become a silent burden, on their skin, their strength, even their safety. What may seem like a harmless habit could carry consequences that last a lifetime. For younger people, a cracked heel or a dizzy spell might pass. But for elders, one fall, one infection, one exhausting shower can tip the balance. So why not adjust? Why not choose comfort over convention? Instead of daily showers, try bathing twice a week. Fill the in-between days with warm cloth wipes, clean clothes, a soft touch of lotion. Instead of struggling under the stream, sit. Rest. Be gentle with yourself. Cleanliness should never come at the cost of exhaustion. Freshness doesn't have to mean submerging your body in water every day. True self-care is not measured in how often we scrub, but in how deeply we listen to what our body needs. Aging is a time to love yourself more, not less. It's a time to write your own rules, in your own rhythm. You can still be beautiful, clean, and confident, in a way that honors your age, your body, and your wisdom. When you begin to rethink bathing with kindness, you may also begin to soften in other areas of your life. Maybe it's how you approach eating. Or how you allow yourself to rest. Or how you forgive yourself for pushing too hard. I'm not saying you should stop bathing. I'm inviting you to look deeper, and choose what works for you now, not what worked 40 years ago. If it makes sense to you, try bathing less often, but caring for your body more lovingly. Bathe less, but moisturize more. Bathe less, but let your heart be at ease. And if this message resonates, share it. Talk to your loved ones. Share it with your parents, your grandparents, your friends. Let them know it's okay to live gently. That hygiene doesn't have to be harsh. That aging can be safer, and softer. If this video touched you, I would love to hear from you in the comments. Have you ever struggled with bathing? Do you know someone who slipped in the bathroom? Are you slowly changing your habits? Your story matters. And if this message feels helpful, please like and subscribe. That simple action helps us share more helpful, hopeful, and heartfelt videos with the senior community. Whatever you choose, may you always feel clean in your spirit, safe in your body, and at peace in every day you live. So what should you do instead of daily bathing? Let's talk about practical, respectful, and gentle alternatives that keep seniors fresh, clean, and safe, without the physical strain or health risks of a full shower. 1. Try sponge bathing, also called a wipe down. Use a soft, clean washcloth or disposable wipe moistened with warm water. Focus on key areas: armpits, groin, feet, face, and hands. These are the spots where sweat and bacteria tend to collect. A quick wipe down takes just a few minutes and helps maintain good hygiene between showers. 2. Dress in fresh, breathable clothes every day. Changing clothes is one of the easiest and most effective hygiene habits. Cotton clothing is ideal, it absorbs moisture, allows the skin to breathe, and reduces odors. Don't forget socks and undergarments. 3. Pay attention to oral hygiene. Brushing teeth twice a day, flossing gently, and rinsing with mouthwash can dramatically reduce bad breath, gum disease, and bacteria buildup. This is especially important for seniors who may take medications that dry out the mouth. 4. Moisturize your skin after every wipe or bath. Use fragrance-free lotions or creams designed for sensitive skin. Focus on arms, legs, elbows, and heels. This helps prevent dryness and cracking, especially in winter months or air-conditioned homes. 5. Keep the bathroom safe and accessible. Install grab bars near the toilet and inside the shower or tub. Use non-slip mats on the floor. A shower chair or bath bench allows seniors to sit while washing, reducing the risk of falling. Always make sure lighting is adequate. 6. Use dry shampoo and body sprays sparingly. Dry shampoo can help keep hair fresh between washes. Lightly scented body sprays or natural deodorants can boost freshness without overwhelming the senses. Just be mindful of any skin sensitivities. 7. Maintain hand hygiene throughout the day. Hands are our most used tools, and the easiest way to spread germs. Wash hands with soap and water after using the bathroom, before eating, and after touching shared surfaces. Keep alcohol-based hand sanitizer handy when outside. 8. Consider a hygiene checklist. Some seniors, or caregivers, find it helpful to use a simple checklist to remember tasks like brush teeth, wipe underarms, change shirt, or moisturize legs. 9. Be patient with yourself. If you feel hesitant to stop daily showers, that's okay. It takes time to adjust routines, especially those you've followed for decades. But remind yourself, this is not neglect. It's a smart, loving choice for your body's current stage of life. 10. Talk with your doctor if you have concerns. If you have specific medical conditions, such as incontinence, wounds, or skin issues, your healthcare provider can give personalized guidance. There's no one-size-fits-all answer, but there are many gentle, effective options. In summary, skipping daily showers doesn't mean skipping self-care. With just a few mindful habits and small changes, you can feel fresh, stay healthy, and live more comfortably every day, in a way that truly honors your age, energy, and dignity. Let your routine evolve with you. Less water. Less risk. More ease. Stay clean, stay confident, and above all, stay kind to why.